I just want to say thank you everyone for joining us today. Greatly appreciate you making the time on a Thursday to come and learn more about the Access Data and Impact State Action Innovation Lab request for proposal. We're hoping to go over what the opportunity is, talk a bit more about the partners, as well as allow for some time for a question and answer. As a reminder, all of the materials are on our data sale roadmap to access microsite that hosts our RFP, so the actual PDF where all the information is, a timeline, as well as the application template, the budget template, and a current version of frequently asked questions. So we'll also be uploading on the web page the recording of this document, or the recording of this meeting, and then also an updated FAQ. Um, as a reminder, in case you just joined, there is a Q&A function in this as it's a webinar, and we're hoping that folks will be able to drop in their questions to the Q&A. It helps us sift through the questions easier than a chat. So with that, I should probably introduce myself. My name is Christian. I'm a senior associate for data and technology innovation at the American Public Human Services Association. I'll be serving as the data sale manager, um, and I'll pass it down the list for folks to introduce themselves. Nana,
Hello, everyone. My name is Nana Sasu, and I am a Senior Process Innovation Associate here at APHSA. And I will pass it over to Michelle Dene.
Hey y'all, Shane here. I am serving on the Community Impact Council member, pardon me, as a Community Impact Council member, and excited to talk a little more about what we're doing today.
great. Cynthia,
Yes, and I'm Cynthia Forland, representing one of the partners here today, the Multi-State Data Collaborative at the National Association of State Workforce Agencies, in charge of state engagement, and special projects. So that's all kinds of fun stuff, and really excited about this opportunity. And you'll hear more from me in just a couple minutes.
great.
I think
Claire,
I'm next. Yeah. Hi, I'm Claire Valdivia. I am a program manager at US Digital Response, also known as USDR. We are another partner collaborating on this effort, and you'll hear more from us soon as well.
Hi
um,
everyone, I'm Didem Tüzemen. I'm a Vice President of Product and Development at the College Initiative. Nice to see you all today.
great.
And I'm Jess Meneely, the Assistant Director for Process Innovation at APHSA. I'll mostly be hanging out in the background and monitoring the chat today, but it's great to see you all here. Thanks for your interest in this awesome opportunity.
Great. Thank you guys. So just to go over the agenda for today, so we'll be speaking briefly on the Access project background. As some background for that, the data sale, so the Data and Impact State Action and Innovation Lab opportunity actually sits under the umbrella of Access, which is also another long acronym. It stands for the Aligned Customer-Centered Ecosystem of Services and Support. And then we'll be going over the request for proposal opportunity. Again, it's available on our microsite page, and then the submitted proposal guidelines, and we'll leave some time at the end for some question and answers. But before diving into the Access project, it would be helpful to learn a bit more about the two organizations that have been involved in Access for the past 2 years. So we'll be starting out with an about for APHSA and NASWA. So for any folks unfamiliar with APHSA, we are a bipartisan organization that supports state and local human services agencies. Our various affinity groups and member spaces include leaders from state, county, and city human services. Our members also vary in terms of what specific areas they cover. So they are specifically focused on family well-being through the access to food and nutrition assistance, healthcare, housing, employment, childcare, various things. We also host a variety of spaces dedicated to either very specific items or more generalist spaces. Um, we also host a variety of conferences. One of those being just next week. We may see some of you there, the Economic Mobility and Wellbeing Conference. And some of you may have gone connected to us through our ISM conference, which is specifically for IT solutions management. With that, I'll pass it to Naswa.
Great, thank you so much. So I'm going to talk a little bit about NASWA and the MSDC. So on the next slide is a little information about the National Association of State Workforce Agencies. We can go to the next slide. So who is NASWA? What is NASWA? It is, in fact, the national organization representing all 50 states plus DC and the US territories and their state workforce agencies. As you may know, those agencies deliver training, employment, career, business, wage and hour services, in addition to the unemployment insurance program, veterans reemployment programs, and labor market information programs. So NASPA provides policy expertise, shares promising practices, and promotes innovation and leadership across state workforce agencies. Next slide, please. Now, the Multi-State Data Collaborative, which is housed at NASWA, is beyond just state workforce agencies and workforce agency development programs. It is sector neutral. It's a state-driven, peer-governed network of agencies and partners working together to use administrative data to inform public policy and improve government programs and ultimately the lives of individuals who are served by those programs. The next slide gives a little more information about ways in which we support the work in the states. I will not be going through all of these items in detail, just to walk through quickly. It's about shared data products and resources. And that means data products that you can populate with your own data, policy influence and collaboration, being able to provide information up to the federal level about what it is that states want, what states need, what they're struggling with, technical infrastructure and support. You're going to hear more about that from Deanam, who's involved with Coleridge, who is the platform organization and is leading the charge on those technical aspects and training aspects. And lastly, capacity building in terms of being able to help state staff build up skills, work on policy issues of interest. And the next slide is just going to let you know if you're interested at all. No membership fees, everyone's welcome, all state agencies across all sectors. If you want to learn more, we've got an email here. And thank you so much for letting me take a moment. And I'm super excited for you to hear soon about this opportunity available to you as state agencies. Thank you.
Thank you, Cynthia. So hopefully that provided a good amount of background on where APHSA and NASWA sit. And so I wanted to pass it to Nana to give a bit of background on what Access has been up to in the past 2 years. And I think that will provide a good amount of context for the data sale opportunity before we go over it.
Thank you, Christian. All right, next slide. So Access is an initiative run by HPHSA and NASWA. And now we actually have a couple more partners that you'll hear about later. And so the goal of the Access project is to ultimately identify and align efforts to modernize and improve programs and services across health, human services, and workforce sectors. And ultimately, we are hoping for a more user-friendly, customer-centered experiences across the ecosystem. And this project is funded by the Gates Foundation. Next slide. So why the Access Project? Many agencies are, or what we found was that many agencies are ready to engage in cross-program alignment, but they are facing multiple challenges that ultimately hinder that work from going forward. And so we also heard from customers who access the programs and services that essentially those programs and services are not necessarily centering their needs. And so, in a nutshell, we really want to make the programs and services work for people rather than people working for those programs. And next slide. Okay, so I'm gonna dive into the how and what we were up to in what we're calling phase one of access. So that was the discovery phase, and we essentially assessed the challenges facing agencies and people accessing the benefits. Um, and we did an assessment through surveys, or we did assessments through surveys and roundtables for state agencies. And then we also did customer interviews, which we called community conversations for people accessing benefits. And through these were co-created with state as well as customer advisory councils, which the Customer Advisory Council is actually now called the Community Impact Council. So we ultimately collectively brainstorm ways to address the challenges that we were seeing in alignment. And so by the end of year one, we did release a brief called Paving Road to Access. We also, in October 2024, as well as March 2025, we held some design workshops, which were co-created and co-facilitated by the Community Impact Council. And in these workshops, state agencies, as well as customers who access the benefits and federal collaborators and funders were invited to collectively envision the future of human services. We also created visual journey mapping as well as ultimately a roadmap to access. And these were also co-created by with our Community Impact Council. So all of these findings and tools can actually be found on our Roadmap to Access website, which is roadmaptoaccess.com. And next slide. Okay, so now we're going to dive into a little bit more on the survey that we did in phase one of Access. Next slide. And essentially, the findings from these really highlighted that cross-system or cross-programmatic alignment, it was the core mission of about 81% of agencies at the time. And the agencies are working to enhance customer experience through streamlined applications and better communications and user-centric program designs. And agencies did share that their biggest challenges were around tech and resource limitations, as well as complex regulations, and misalignment in performance measurement and privacy concerns. And next slide. Okay. And as I mentioned earlier, we did release a brief to highlight the findings from phase one, and this can also be found on the Roadmap to Access website. So this really highlighted the promising practice and then also the findings that we obtained from phase one really laid the foundation for phase two, which is why we're here today. Next slide. And now we're going to dive into a little bit with our customer engagement strategies. Next slide. All right, and then I will actually hand this over to Michelle Dene, who is on our Community Impact Council.
Hey everyone. Thank you, Nana, for taking us back through that. As you were talking, I was reflecting on the conversations we got to have with people who were utilizing these systems or have in the past and how impactful it was for them to have their voices heard. So as we're building this, I think it's important to bring in the work that the Community Impact Council has had, because we've all have different levels of lived experience using these or using them currently. And it's really exciting to see the potential for incorporating human-centered design and for implementing these technologies that are really going to help grow this entire field.
Awesome. Thank you so much, Michelle. All right, next slide. So as Michelle mentioned, we did implement human-centered design in our process. So we utilized design thinking, and we essentially worked with our community impact council to really dive into the customer perspectives as it relates to alignment. So we really focused, like Michelle said, on having those meaningful conversations and emphasizing things like empathy and just really working to co-create and collaborate for to ultimately kind of capture that experiences. And so those were really captured in those customer journey maps, which are available to view on the website. Next slide. All right. And essentially, we ultimately work to kind of build all of these together into laying that foundation and doing that groundwork to feed into Access Phase 2, which brings us to the state action and implementation labs. And the Project North Star is essentially public sector leaders and practitioners across the health, human services, and workforce ecosystem working together to align services and supports their agencies administer in partnership with their customers and in service of improved customer experience. And I will hand it back over to Christian.
Thank you, Nana. And so that brings us to today, to our opportunity called the Data Impact and State Action Innovation Lab. I will just be referring to it as Data Sale, and I'm sure many of our partners will also just be referring to it as Data Sale because it is quite a long name. But at a high level, the goal of the Data Sale opportunity is to develop and implement customer-centered data and tech solutions, really for a more cohesive service delivery across health, human services, and workforce programs. The award would be provided to 3 states, and each would receive up to 200,000 innovation funds for a project period running from January 2026 to December 2026. Along with the award, there would also be technical assistance. So that would be provided by APHSA, NASWA, and our key partners who we'll hear from in a bit. The selected teams would participate in a monthly cohort learning. So we are utilizing the peer cohort model where there will be direct team technical assistance, but also time for the 3 selected state teams to come together and share their different learnings. And then, because I'm sure there are a variety of different ideas of different formations of governments, that there would be additional supports provided depending on the team's submitted proposal. So we would be excited to see a lot of creativity in what you guys put together. For our key partners, APHSA, the Community Impact Council, who you heard a little bit about from Michelle, as well as NASWA, specifically the Multi-State Data Collaborative, and then the Coleridge Initiative and U.S. Digital Response, who were really excited to be bringing into data sale. And so with that, I'll pass it to Didam to speak a bit more about the Coleridge Initiative, and then I'll pass it to Claire to talk a bit about U.S. digital response.
Thank you, Christian. Okay, let me give you an overview of the Coleridge Initiative. Let's move to the next slide. So we are a nonprofit with a clear mission to build capacity in governmental agencies to empower a better use of the administrative data, and that is to inform decision making and providing evidence-based policy. So for this goal, we are providing several services to government agencies. The first one being a secure research platform that is called the Administrative Data Research Facility, or the ADRF. Then we provide some trainings that are called applied data analytics trainings, which I'll talk about in more detail. Then we have some specialized state programs, one of them being the Democratizing Our Data Challenge. And then we really put a lot of emphasis for cross-state collaboration and multi-state data networks. So with that, let's turn to the next slide to talk about our administrative data research facility. This is a FedRAMP secure computing platform designed to first host administrative data and also promote collaboration and facilitate work within different agencies. So the first thing to note is the secure data sharing. So this is, as I said, FedRAMP secure. You can think of it as a safe where government agencies can bring in their administrative data and they can work on their administrative data through the platform for their own agencies or do work with other agencies because data sharing is secure in this environment. It allows for data integration. We do provide technical assistance for providing data infrastructure. And then we also help with the governance frameworks. So from helping with the NDAs, DSAs, to talking about best practices in governance and management of data. And we are serving a wide range of agencies, research analysts, government data stewards through this platform. When the data comes to the platform from a government agency, the agency is still the data platform. So this is still the data steward. We're providing the platform, so the owner is still that agency, but they are bringing in their data because it's secure and it allows for easy collaboration within the platform. Okay, with that one, let's move to the next one. The other one is we are providing training services through our Applied Data Analytics program. So this is really meeting the government agencies where they need us. These ADA trainings are usually geared towards a project. And we do provide confidential microdata access at the ADRF during these trainings. So as I said, it's related to a project. So the approach is to understand that project and help the government agency staff to use the data in the ADRF to work towards their goals in that project. And courses are generally last 4 to 6 months, meeting 1 to 2 times a week. And so far, we have had 43 classes, over 1,200 participants. We could reach to almost 400 organizations across 46 states. And we have covered topics in different domains, from labor demands to child welfare. Again, providing information and tools to empower the staff at the government agencies as they start working with micro level data in the ADRF and do other projects. Next one, please. Now, another service that we provide is the Democratizing Our Data Challenge program. So you can think of this as our matchmaking program. So we open up for LOIs and government agencies come to us with very interesting and big ideas. They bring their project proposals to us, and we meet with funders and understand what kind of projects the funders are willing to support, and we do the matchmaking between these really great ideas, proposals, and the funders. So far, this project helps agencies across 10 states that corresponded to over 66 individuals, 12 teams, and 21 major agencies and 7 universities to produce new data products for data and evidence-based policymaking. What are these products? There are new data models and applications. There are some dashboards, new portals. These are all geared to support policymaking at the state or federal level, at the agency level, basically. And we've had, of course, great support from the funders, the Ascendium Foundation, Bill and Melinda Gates, Overdeck Family, and Walton Family Foundations. And let me say that we have done 3 rounds of the Democratizing Our Data Challenge program. That's what the 12 teams correspond to. And we're getting ready to launch the round 4 next year. So please stay tuned. Moving to the next slide. Now, as I said, our services are geared towards our mission of empowering government agencies, whether it's through providing our, of course, FedRAMP secure platform, whether through trainings, whether through the DDC program that I just talked about. We have a special emphasis on multi-state data products and different states working together within the ADRF platform. So I just wanted to conclude with one important example of this multi-states data product, which is the post-secondary dashboard. So this dashboard provides a better understanding of the employment outcomes of individuals who completed a credential within the state's higher education programs. So we developed this first with partnership with KY Stats, and then it has been expanded to include Ohio, Indiana, Tennessee, and the eastern states. And some of this was actually within support of the DDC program. So just to emphasize, we really put emphasis on multi-state data products and collaboration across different agencies within and across states. Okay, with that, let me conclude. Let's move to the next slide. So please stay in touch. Here is some of the ways you can stay informed. Please subscribe to our emailing list. And if you have any questions, please feel free to find us. Thank you.
Thank you, Dito. And with that, I'll pass it to Claire to speak to us a bit about USDR.
Thank you. Hi, I'm Claire Valdivia again, and yeah, excited to talk to you about U.S. Digital Response. Could you go to the next slide, please? So U.S. Digital Response is a nonprofit organization, and we provide pro bono support to governments who are looking to address critical needs, improve service delivery, and level up impact. We pair pro bono technical talent with public servants across the country at all levels of government, and we're here to help governments deliver for the now and keep up with what comes in the future. So we were born in the beginning of the COVID-19 pandemic, when it was clear that governments across the country needed support moving services online. And then we iterated quickly to meet changing needs, which I'll talk about in a moment. Next slide. We work on a short-term consulting model, and what this means is that we're focused on work that can be delivered primarily over the course of 2 to 3 months in partnerships with government teams. So we pride ourselves on being nonpartisan and working with governments on a variety of issues from all corners of the country and doing it for free. Next slide. So we work to meet governments where they are and support on their most pressing needs. So as we started primarily as emergency response at the beginning of the pandemic, since then we've developed different offerings in the areas on this slide to support governments where they've indicated needs. So our core offerings now span these various areas, including generative AI, technology, procurement, talent and hiring, language access, user research, elections, benefits delivery, and others. Some of also have responsive to critical needs, as we've just recently kind of formed, for example, the benefits delivery team as one of our new offerings. Next slide, thank you. And we do all of this by matching needs for help from governments with availability of skilled volunteers. By collaborating and growing our community, we aim to support with immediate needs, but we also want to grow the broader community of folks doing this type of work in the U.S. government. Next slide. So since we were founded in 2020, we've completed over 600 projects across the country, deploying about 1,500 volunteers to deliver support. So now a little bit about how we do this and how we work. You can go to the next slide. So it's really as simple as it sounds. Generally, we get a request from a government. We connect and try to bring help as soon as we can to figure out the scope of that need. And then we work to staff those projects with volunteers to deliver results as quickly as possible. Next slide. There's a lot of text on this slide, but just wanted to share a few examples of the projects that USDR has done in the past and our lens in it. So we've worked with Pennsylvania to do user research and develop wireframes to redesign their unemployment fraud reporting tool. We partnered with St. Louis to implement Airtable as a low-code tool to replace their case management system, which was for which they were previously using Excel. And this resulted in a large decrease in the time it took to place those experiencing homelessness into homes. That decrease was 90 to 27 days. So really did a lot there to support with the workflows around their case management with impact in mind. And the final example is New Jersey. We we partnered with them on an effort that used a combination of newer technology with AI as well as human validation to improve translation work for unemployment insurance forms and decrease the time overall, as well as with overall to complete those forms and get parity between English and Spanish users who completed the form. So while many of our projects involve data in different ways, throughout all the work, we aim to bring our expertise in different areas like user research and low-code tools to meet governments where they are and help you solve the most pressing needs in a way that's sustainable after the project. And so some of the skills we bring are listed here, but really the takeaway here is that through a combination of our staff expertise and our large volunteer network, we work to pair the expertise needed for the project's, the relevant project. Next slide. Oh, there they are. Great. So these are some of our core principles that we follow in our work, which is really rooted in testing ideas and delivering value quickly, focusing on end users first and foremost, and working to enable our government partners to build capacity to support longer term efforts. We really want to make sure that projects are able to continue after we're finished working on them. And a lot of that means building capacity in the governments that we partner with. All right, next slide. So finally, we're committed to our partners. We always work to meet partners where they are, work collaboratively and find ways to better position governments to meet the needs of the people that you serve. And then our final slide is just, we're pretty proud of this number. We survey all partners that we work with and after we wrap up a project, and we have so far unanimous they're unanimous in their belief that peers should work with us. And so, yeah, excited for potential partnership and working on this effort together.
Thank you, Claire. Thank you, Dita. I really appreciate the overview from both your organizations. If you have any questions for either of them, again, just reminding folks to please use the Q&A function. Feel free to drop whatever questions and we'll hopefully get to them at the end. So after learning a bit more about the data sale partners, just wanted to shift back to a bit about RFP logistics. So all of this information that I'll be presenting on in the next few slides are available on the data sale page, as well as on the RFP PDF. So our letter of intent is due August 29th, which I know is coming up really quickly. And I'll speak a bit more to it later as well. But I want to just let folks know the letter of intent, any information provided in it, whether it's partners or the idea itself, is not binding, and that we will not be using it against your evaluation either. So feel free to submit who will be working on the proposal and then what the idea is so far. And it's totally okay if the end proposal ends up being a little bit different or very different. I would just encourage folks to submit as soon as they can. And we're using this mostly for our internal planning. So it's also possible to submit a full proposal without submitting a letter of intent, but we would highly encourage you to please help us just in terms of our own internal planning and being able to figure out a reasonable evaluation timeline as well. So getting to that, the proposal submission deadline is September 19th. I'll go over the three items that are required for the proposal submission, but that is all due on September 19th. Anticipated award notifications. This may be dependent on the volume of proposals that we get, but we're aiming for around mid-October to be able to get back to states and let them know if they've been awarded the data sale opportunity. Anticipated state site visits. I'll go over what each of these next events are a bit later, but the anticipated state site events would be the end of this year with an in-person grant kickoff at the very beginning of next year in January 2026. As I mentioned before, the lab duration would be January to December of 2026. So that includes the use of the innovation grant as well as technical assistance provided. The ISM conference session, so that piece is around just sharing learnings that have come out from the data sale opportunity, as well as just connecting with other peers on what challenges and barriers they're experiencing as well. The anticipated end of the innovation funds would be the end of December, so December 31st, 2026. Um, I'm just going to speak very briefly about eligibility. So this is just the minimum eligibility. So only U.S. states are eligible to apply for this opportunity. This opportunity is specifically interested in cross-sector alignment at the state level. So of course there can be more partners on the proposal. There can be non-government partners on the proposal, but all proposals must be led by state agency employees in health, human services, and/or workforce agencies. Um, Completely understanding that there could be a different formation of government where it would make most sense to include certain agencies and not others. So it would be great to just be able to understand that through your proposal. The project budget would be for up to 200,000 for a 12-month period, running from January 2026 to December 2026. We provided a um, we provided a budget template on the data sale page, so I encourage you to download it. If you're unable to download any of the materials, please let me know and I can just immediately email them to you and get them to you. But it's really just asking folks to be able to outline what different items would go into their budgets. Also wanted to specify that costs related to the convenings or travel outlined in the RFP would be covered separately. So you do not need to say, hotel and plane in the specific budget for ISM because those will be covered separately. And those will be covered by APHSA. There is a budget summary portion within the Word application, the Word template application. And in there, we just suggest that you summarize and provide justification for the total project cost. And let us know how do the components of the proposal's budget really relate to the proposal's goals, timeline, and partner composition. So a strong proposal would really help us understand why you brought in certain partners and why certain expenses are at what time. I'll go over this project team section. These are the minimum requirements. Again, strong proposals would illustrate how their proposals support alignment among all three sectors, health, human services, and/or workforce. There can also be additional partners outside of these areas again, but these are again just the minimum requirements. The four-person team minimum, we outline in the RFP a description of each of these roles in the RFP. But just to go over them briefly, there would be a data and technology lead, a workforce program lead, a health and human services program lead, and then a customer experience lead. So for the first three, these would be fulfilled by a person who is currently employed by a state agency. And their role is to really have ownership of the progress and barriers arising in those areas, serving as a liaison to the grant partners. So those are all the partners that presented today: APHSA, NASWA, Coleridge, USDR. Um, and the customer experience lead is actually a little bit unique. So the role of the customer experience lead is to keep the team's focus on improving customer experience across those three sectors. Um, and this person cannot be a current employee of the applying state agency. Um, as, uh, Specifically, this person would also be someone with experience, with lived experience accessing or navigating health and human services and or workforce. But we fully recognize that states have various capacities or expertise in working with people with lived experience. So APHSA and its Community Impact Council can support the recruitment of a customer experience lead from your state if your state team is selected. So while this person does not need to be named in the submitted proposal, if you could please outline how the proposal would be inclusive of the customer experience lead and how the proposal would really utilize their expertise. Also illustrated in or spoken about in the RFP, this lead would also join the Community Impact Council, but the budget to compensate for their time would come from the awarded innovation funds. Um, you also see in the Word template that there, on the very first page, at the very bottom, there is a section for a designated project manager. This person would come from one of those collaborative core team members, and they would really just be the point of contact for RFP submission and hopefully as the lab goes into into planning and implementation. This section is just speaking about the project activities, products, and deliverables. I just wanted to preface that any of the examples we provide are just examples. I would highly suggest that you do not limit your ideas to these examples. But just to go over what each of these are, project activities, really talking about what are those activities that really operationalize that innovative process. So some examples could be conducting user research, conducting customer experience design sessions, connecting vendor products to existing services or systems. There are other examples outlined in the RFP, but the idea is just what are you doing to be able to get to that intended deliverable or that intended outcome. The product and deliverables are just exactly that. So, how it would be very helpful to know how those deliverables align with the proposal's goals and intended impact. Um, how APHSA and its partners can contribute to development of products and deliverables. So some examples being training modules, data mapping documentation, governance frameworks. These are all items that Claire and DDIM and NASBA, as well including APHSA, have referenced. So excited to see which products and deliverables folks come up with. This slide is just speaking a bit more about some examples that we've also illustrated in the request for proposal. I won't go over the slide in detail, but including it in case there are some more ideas that this helps spark. The, as I mentioned, this is a cohort model in terms of technical assistance and learning. So there would be monthly learning cohort calls with the peer sites. So the other two state teams that were also accepted, the goal of these meetings are to really share on the progress of your projects and also the progress that you're making with the providers or with the partners. Um, and then the direct technical assistance would be provided by all the folks who spoke today, including the Community Impact Council, and would be co-designed with you as the state team. The in-person convenings. So these are outlined in the request for proposal. The state site visits, those would be at the end of this year. APHA and its Community Impact Council would help develop a one-day economic mobility summit in the award recipient's home state. So the purpose of this activity would really be to bring greater community voice and lived experience into the state level planning and implementation for your proposal. Then there's the in-person kickoff event. That would be done at the very beginning of next year. And that's to bring together all the different partners, all the different state teams that were accepted and awarded, just for them to be able to connect and understand how each of their projects fit into the bigger picture of access. And then the ISM conference. This is one of the conferences that APHSA holds, specifically focusing on IT or government technology. This one specifically is around the states would specifically share their findings, their learnings on what's come out from their data sale opportunity. This is just going over a bit over the proposal submission. So again, reiterating, proposals should be led and developed by two state agencies in health, human services, and workforce at a minimum. Um, if you could please use the Word template to complete the application and provide a preliminary budget. We provided a budget template, but it's very basic. It's okay for it to be that basic. But if there's any other format that you'd like your budget to come in, that is also okay to submit as well. It just helps us understand on what timeline the $200,000 will be spent on and on what and how it would be connected to your proposal. And also providing at least two letters of commitment from leadership from applying state agencies. This helps us understand how your state agency leadership sees the project, and provide a commitment of moving it into implementation and us understanding that this is a viable project. And if you could please submit all the materials via email on September 19th. We shared a little bit about the evaluation process in the RFP, but I've pulled out the scoring categories here to just to voice them over a little bit. So we will be reviewing the impact of the proposal to ultimately support the shared health, human services, and workforce participation um, of the identified state level programs. Also discussing a bit about the strength of the project team structure and collaboration strategy. So that's including both the government agencies that are involved and also the non-government agencies. And then the demonstrated capacity of the team to engage with people with lived experience and really learn from what they're hearing from their customers and then be able to act upon it. The detailed plans for engaging and sharing with colleagues and other human services or workforce program agencies. So really the awarded state teams being excited to really share their findings with peers in the cohort model and also with peers across states and venues like ISM or other conferences or webinars. I spoke about this a little bit, but the letter of intent the deadline is August 29th. If you open up the link on our microsite page, you'll see that it asks for who are the lead agencies, perhaps naming who specifically in there would be on the proposal and what the current idea or proposal is. Um, just to reiterate, this information would not be binding, and that it would not be used in the final evaluation, but it is being used in terms of our internal planning for the evaluation, being able to understand which states are interested in applying, where we can provide more information, and things like that. And so just to reiterate, the proposal checklist would include the proposal application, the Word template, the preliminary budget, whether it's in the Excel template file or not, and then two letters of commitment from agency leadership in health, human services, and workforce. Um, we also say that we are accepting of any letters from partner orgs that are interested in partnering with your state agencies on the proposal as well. And so this is our question portion. I realize we only have 8 minutes left in our meeting, but want to make sure that we got to any questions that came out. Jess, could you help me find the questions?
Yes, I am also typing away some answers. So if you asked a question, there's a little answered tab. Hopefully you can see those answered questions just in the interest of time, trying to answer some as we go. Um, but I will read some out loud, Christian. So first we have, is having a workforce component a requirement or strongly encouraged? Or could the partnership focus more on health and human services? Do you want to take that? Or do you want
I
me to?
can, I can start, and then Jess, please feel free to jump in, or any of our partners as well to jump into any of these questions. I would say that a strong proposal would be able to show alignment across all three of the sectors. That is our ultimate goal with being able to provide out the data sale opportunity. Jess, if you'd like to elaborate any more.
No, I think that's right. I would encourage you to just think about how workforce and your cross-program partners can bolster your health and human services project if that's what you're kind of starting from. Um, but yeah, curious to see what you're thinking about in your proposal. And so we have another one. Who would be an ideal candidate for this grant? I think I can quickly take that and just say a partnership between state agencies, or if you have an agency that administers programs across health, human services, and labor agencies, or I'm sorry, and labor programs. We know that there's a lot of different kind of constitutions across state agencies. So you would be an ideal candidate, or you and your partner agencies would be ideal candidates. The next one here is I heard that it's FedRAMP compliant. So that I believe is in reference to the ADRF DDEM, but did not hear if the platform currently houses tax data, FTI. Could you speak to that, DDEM?
We typically do not talk about which data sets are available in the ADRF. If it's a data set to be used for a project, it can be definitely housed in the ADRF. So I'll leave it there. The FedRAMP secure portion is related to, states and agencies feeling comfortable that their administrative data will be safely secured in the ADRF. And we are currently housing data in different domains from many states and federal agencies.
Awesome. And then the next one, how long are the USDR resources assigned to a project? Is there a maximum amount of time? So for our partnership, we've assembled this subject matter and expert network across Coleridge, USDR, NASWA, and APHSA for the data lab for the year. However, if you want to engage like the ADRF or Coleridge's um, professional services in your individual project, or for example, USDR's services in your individual project, you can include that in your proposal. That would again be for the year, and DDEM and Claire can also help you with assembling that into your proposal. They have limitless kind of amounts of time that they can engage with your agencies. But for this data lab, we as a network will be available to you for technical assistance, kind of as a group, as a cohort. I hope that helps. The next one here is is this only for state level groups to apply for? We're a local workforce board that is piloting an integrated service program with state workforce social services and public health as a pilot for statewide duplication. That's a really interesting question. This is scoped as a state level initiative. That's what you're describing is a little bit kind of outside of what we were envisioning. However, I don't want to preclude you from applying because you are saying here in this question that you're working with state workforce, social services, and public health agencies. So I would encourage you to kind of partner with those state agency professionals and co-develop a proposal if it works with them. Can multiple administrations within a human services department collaborate, or would you like to see a standalone executive level departments? I'll answer that with yes, multiple administrations can collaborate. Actually, cross-departmental collaboration is encouraged here. Is it correct that workforce lead must be included in the team, even if the workforce agency is not part of the application team? No. So your team can just include the agencies that you are working with on your project. However, we would encourage you to engage your workforce agency and labor and workforce as an element of your project, just in service of building that aligned ecosystem across health, human services, and labor. And finally, checking through here, is the LOI mandatory for applying? Again, no, it's not mandatory. You can definitely still submit a proposal if you're not able to get the LOI in by the end of the month. But it is really helpful for our team to know if you're intending to apply. Also, if you have a really good sense that you will be applying, but you don't have all of the information that the LOI form calls for, feel free to submit that still. The form itself is really simple. So if you kind of take a look at that form online, I think you'll see that it's pretty easy to complete and just kind of let us know that you're interested. And I think I ticked through everything that came in live here. So Christian, with a minute left, I'm gonna turn it back.
Thanks, Jess. Well, just want to say thank you for sticking with us all the way through this data sale information session. As a reminder, this meeting was recorded, so we'll be posting it to our data sale page. Feel free to share it with colleagues or with potential partners on your proposal. And we'll also be posting an updated FAQ with your questions that you submitted today, as well as some other questions that folks submitted through Zoom or through the Smart Sheet. I hopefully answered some of those questions through this presentation, but feel free to continue submitting questions if you have them, and we'll continue answering them. Again, thank you everyone for coming today, and thank you to our panelists as well for sharing all about their great orgs.